Good evening, everyone. On behalf of Sri Lanka College of Internal Medicine, I warmly welcome you all for another BLISS program. BLISS means happiness. The Welfare Committee of the Sri Lanka College of Internal Medicine have designed this program to enhance the happiness and the psychological well-being of our colleagues and fellow doctors in our country. So far, we have discussed several BLISS programs under different themes. Today also, we are going to have another important, timely topic. It's all about devices, smartphone and the devices. Today, we have expert with us, Dr. Darshani Hettiarachchi, consultant child and adolescent psychiatrist attached to Teaching Hospital, Karapitiya. Before the lecture, I cordially invite Dr. Kumudini Jayasinghe, President of Sri Lanka College of Internal Medicine, to address all. Over to you, Kumudini.
Thank you, Bandhu. Good evening, everyone. I warmly welcome Dr. Darshani Hettiarachchi, the speaker today, Bandhu, Chamara, Manoj, and all the council members and other doctors to this BLISS program today. The BLISS, as Bandhu said, actually this was established last year by our immediate past president, Dr. Ganakasena Ratna, to bring happiness and welfare to the members. We are actually discussing topics beyond medicine. Last year, we have discussed many interesting topics, and today I think we are going to have another interesting topic. This is our 7th BLISS program, and our sincere thanks go to Dr. Darshani Hettiarachchi, consultant child and adolescent psychiatrist, for doing this timely topic, smartphones and tablet addiction among children. So I must appreciate Dr. Bandusiri Rathnayake for his excellent organization throughout for this program, and Dr. Tushari, council member, for supporting Bandhu this year, and Chamara and Kolita, secretaries, for helping the BLISS program for the organization. And without further ado, I invite Bandhu to continue with the proceedings today. Thank you, Bandhu, and we welcome all of you to listen to this program tonight. Thank you.
Thank you very much, Kumudini. I would like to draw your kind attention for a few housekeeping rules. The lecture time would be 45 minutes. During lecture time, I kindly request you to mute your devices. And at the end of the lecture, there will be a Q&A session. You can unmute your devices and can directly ask the questions from Dr. Hettiarachchi, or you can put your questions in the chat box. Without further ado, may I introduce our speaker to the audience. Dr. Darshani Buddhika Hettiarachchi, MBBS, MD, Psychiatry. Dr. Hettiarachchi graduated from Faculty of Medicine, University of Colombo in year 2005. She obtained MD Psychiatry from University of Colombo in year 2015. Dr. Hettiarachchi completed her overseas training from March 2017 to February 2019 in Townsville Hospital and Health Service, Queensland, Australia. She has many publications in local and international journals. Currently, Dr. Hettiarachchi is working as consultant child and adolescent psychiatrist in Teaching Hospital, Karapitiya. Today, she is going to talk about smartphone and tablet addiction among children. Are you worried about your kids? Over to you, Dr. Hettiarachchi. Thank you very much.
Thank you, Dr. Bandusiri. And first of all, good evening, everyone. First of all, I would like to thank Sri Lanka College of Internal Medicine for giving me this opportunity It's a great honor for me to participate in this forum. And also I would like to give my special gratitude to Dr. Kumudini Jayasinghe and Dr. Bandusiri Rathnayake. So before taking time, I would like to start my presentation. So during, can you all hear me clearly? Dr. Bandusiri?
Yes, Darshani, we can
Yes,
very well
madam.
hear, and
Yeah.
we can see the
Slides.
we can
Yeah.
yes, yeah.
So, so during next 45 minutes, I will be focused on smartphone tablet addiction in children. Are you worried about your kids? So this is a timely needed topic. As a child and adolescent psychiatrist, we are struggling. We are facing a lot of challenges related to this issue. So I think it's a timely needed topic to discuss today. And before moving to the main presentation, I want you all to just look at this slide. This is a knife. Just imagine. I would like to make a kind request from the audience. If you all can mute your microphones, then it will be more easier for all the audience to get engaged. Otherwise, sometimes if the background noise is going on, it's difficult. Yeah, thank you so much. So just look at this. It's a kind of a knife. Just imagine a life, day-to-day life without a knife. We need it. If we think about it, it's a kind of very important appliance for our day-to-day practice. But if we do not use it properly, or if we do not handle it with care, we can cut ourselves. And also we can hurt other people also. Likewise, we can't keep our children away from these devices. Devices are needed for their day-to-day practice and for their learning and so many things. So as adults, as parents, what we should do is we should teach them and we should guide them and train them to handle it with care. So my lecture contains the place of technological devices in modern world. What is this device addiction and what are the adverse consequences of device addiction and how we are going to manage that problem. So place of technological devices in modern world. This digital technology has already changed the world. I think we all aware about it, and more children go online around the world. It is increasingly changing their childhood. Youth, age from 15 to 24 is the most connected age group. And worldwide, 71% of youth are online compared with 48% of the total population. And under 18 account for an estimated 1 in 3 internet users around the world. So what are the advantages globally? The connectivity. It can be a game changer for some of the world's most marginalized children and helping them fulfill their potentials, break into generational cycles of poverty, so many things. And it provides more opportunities for learning and education, more access to economic opportunities, and also more access to information. So these are the advantages. What are the global disadvantages? This digital access is becoming the new dividing line because millions of children do not have access. About 29% of youth worldwide, that is around 346 million individuals, do not have access to online. And African youth are the least connected. Children who rely, and also children who rely on mobile phones rather than computers may get only second best online experience. And children who lack digital skills or speak minority languages, they can find, they can have disadvantages. And also, these digital devices also mirror prevailing economic gaps, that is, which amplifying the advantages of children from wealthier backgrounds and failing to deliver opportunities to the poorest and most disadvantaged children. I think we saw it during this COVID crisis as well as this economic crisis. So most of the children from affluent families had the opportunity to get access to education through online education, but the children from deprived families had very limited access to education. And digital gender gap, that is globally 12% more men than women use the internet. In 2017, in India, less than 1/3 of internet users are female. And also there are some challenges in proper verification of sources. So what is internet addiction? We are using so many words related to this. So what is internet addiction? Internet addiction is a complex and emerging issue. Thus, it's difficult to find a single and widely accepted definition. In 1996, psychiatrist from New York, Ivan Goldberg, he first reported internet addiction disorder. So even though we see different presentations and we use different terminologies for this problem, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition by American Psychiatric Association, they have identified only one problem as a disorder, that is the internet gaming disorder. So according to DSM-5, internet gaming disorder is the persistent and recurrent use of the internet to engage in games, often with other players, leading to significant impairment or distress as indicated by 5 or more following in 12 months. So let's see what are these symptoms. One is preoccupation with internet games. That is, they always think about it. And withdrawal symptoms when internet gaming is taken away, like anxiety, irritability, aggressive behavior, sadness. And tolerance, that is, gradual increase in the number of hours they spend on internet for gaming. And unsuccessful attempt to control the behavior, that is, they try to quit the behavior, but still it becomes unsuccessful and they go back to the previous behavior. And loss of interest in previous hobbies and entertainments as a result of internet games. And continued excessive use of internet games despite knowledge of psychosocial problems. So they are already aware about the problem, still they can't stop the behavior. And has deceived the family members, therapists, or others regarding the amount of internet gaming. That is, they become secretive. And use of internet to escape or relieve negative moods, because with time they start developing low mood, anxiety. So they start continue the internet gaming to escape or relieve this negative mood. And has jeopardized or lost a significant relationship, job, education, or career opportunities because of these internet games. So these are the symptoms according to DSM-5, and 5 out of 9 has to be there for 1 year to come to this diagnosis, internet gaming disorder, and start interventions. So, but I think you all will agree with me, in our day-to-day life as well as in our clinical practice, we see different clinical presentations and we use multiple terminologies like pathological internet use, cyberspace addiction, cyber affairs, relational addiction. Some people have relationships through the internet and they get addicted to it, and mobile phone dependence and social network site addiction. They start social networks and they get addicted to these social networks. And some, I think we can see so many people, children, adolescents with Facebook addiction and internet pornography addiction, many more. So I think it needs to be further evaluations and research on diagnostic criteria, assessment tools, and conceptual formulation. So what I want to say is that even though DSM-5 has given importance to one diagnosis, that is the internet gaming disorder, we see so many other problems, clinical presentations, and we use so many terminologies. So I think we only see the tip of the iceberg, yet to explore so many problems which we have not seen yet. So rather than focusing on this addiction, I think we should focus on problematic internet use. So what is problematic internet use? A psychologist called K.M., he was the person who first published a detailed case report of problematic internet use, that is in 1996. So problematic internet use is characterized by overuse of the internet with associated impairments across various domains of functioning, either physical, educational, relationship, financial, legal, psychological, and etc. So I think what is the important thing is whenever a child or an adult is having any kind of functional impairment in any domain like physical, educational, relationship, financial, legal, anything, due to excessive use of internet, then we should call it problematic internet use. And I think that is the point we should start intervening. So what are these psychological and behavioral theories behind this technology addiction? One is the learning theory. It emphasizes the positive reinforcing effects of technological use, which can induce feelings of well-being, euphoria, that is the happiness in the user, and works on the principles of operant conditioning. So when they become happy, when it makes them happy and feeling well, then they start using it more and more. And the reward deficiency hypothesis. So according to that, those who achieve less satisfaction from natural rewards, for example, food, water, sex, they turn to substances to seek enhanced stimulation from reward pathways. So technology use also provides immediate reward with minimum delay, so which results in similar to substances and alcohol, drugs. So they tend to, the individuals with reward deficiency, they tend to get addicted to these devices. And impulsivity, it is seen as a risk factor for development of addiction. So internet use is linked to sensation seeking, which is a substrate of impulsivity. So individuals who are impulsive tend to use internet as a sensation seeking tool and can become addicted to it. And another model is the cognitive behavioral model. So according to the cognitive behavioral model, catastrophic thinking might contribute to compulsive internet use, providing psychological escape mechanism to provide real or perceived problems. So when they have real problems, or when they have perceived problems, they use internet as a way of escaping their problems. And also social skills deficit theory, which explains the individuals with poor social skills, poor social competence, who may also be anxious about social interactions. So when they are anxious, when they don't go to have real social interactions, they drawn to this anonymity of the internet and the opportunities it affords for developing relationships in less threatening circumstances than those occurring face-to-face. So according to the social skills deficit theory, individuals who are lacking social skills and who are scared of developing social face-to-face social skills, they tend to develop these social interactions, which are very artificial, but to develop this artificial, less threatening social interactions through internet access. So let's move on to the children and adolescents. So I think that is the main problem, the thing that we need to focus during today's presentation. Why do children and adolescents use internet? Maybe for education purposes, learning to learn new things, seeking knowledge on technology, science, doing research, or maybe for entertainment. Either they want to watch movies, play games, do online shopping, different things, or to address their psychological needs. They may need to killing out their boredom, forgetting problems, relaxing, get rid of stress, or as a way of socialization, talking to friends, searching new friends, sharing ideas. So many reasons for them to get access to technology. So we are focusing on problematic internet use, and what are the risk factors for problematic internet use and addiction in children and adolescents? There can be multiple risk factors. individuals who are having mental health issues like attention deficit hyperactivity disorder, social anxiety, generalized anxiety, obsessive compulsive disorder, depression, aggression, impulsivity are at higher risk of developing problematic internet use as well as internet addiction. And adolescents, age per se is a risk factor due to their sensation seeking and novelty seeking behavior. And personality-related factors, as I mentioned, according to the theories, like individuals who are having limited social skills, low self-esteem, interpersonal difficulties are at high risk. And also social and environmental factors like family-related factors, parental conflicts, family dysfunction, poor adult supervision. And so school-related problems like high demands for achievements, peer influence, and other important thing is free availability and accessibility, which happened during COVID time and during the online education related to the COVID pandemic, where internet became freely available and more accessibility, which resulted in developing problematic internet use and internet addiction in so many children, and also influence from advertisements. So let's focus on what are the adverse consequences of problematic internet use and addiction. There can be physical, psychological, social, as well as cognitive adverse consequences. So physically, they can develop headache, problems with vision, spinal deformities, problems with the wrist, carpal tunnel syndrome, with metabolic syndrome. Their metabolic risk can rise, like weight gain, obesity, and sleep problems. And psychological issues like loneliness, withdrawal from family, poor self-esteem, increased aggression, violence, antisocial behaviors, social difficulties, reduced pro-social behavior, and lack of empathy. And also individuals, when they get addicted or when they are having problematic internet use, they can have increased mental health issues like anxiety, depression, suicidal ideas, and self-harming behaviors. And how it affects the social life in a negative manner. It can lead to lower quality of life, worsening scholastic outcome, occupational difficulties, loneliness, relationship problems. And what are the cognitive impact? So these problematic internet use and addiction can negatively affect the children and adolescents' memory, attention span, abilities for critical reasoning, language acquisition, reading, learning. So all these cognitive skills can be affected due to this. So now we discuss about the symptoms, now we discuss about the risk factors, and we discuss the adverse consequences. Now let's move on to the management, how we are going to manage this problem. First thing is prevention, because as a child and adolescent psychiatrist, we usually see 3-4 new individuals per day with problematic internet use or internet addiction. So when they develop this addiction, it's very difficult to manage. So the most important thing is prevention and health promotion. So helping individual to get engaged in online environment in a safe and healthier manner. So this should be done with multi-systemic approach involving parents, school, the community, and other relevant stakeholders in guiding prevention efforts. So what are the approaches? What are the preventive measures which can be done? The one area is the school-based prevention, other is to enhance personal protective factors in the individual. So what are the school-based prevention programs? One is the teacher and parent training and student education, increase awareness, enhance protective factors and reinforce positive behaviors, and environmental modifications that reduce the likelihood of negative occurrences. And the other important thing is enhance the personal protective factors of the individual and promote the psychosocial competencies. As I have been discussing during my last couple of slides, individuals with different cognitive errors and with poor social skills and impulsivity, poor problem solving skills. All these factors can lead to get them to involve in problematic internet use. So it's very important to identify their deficits and then empower them and enhance their personal protective factors like critical evaluation skills, improve their social skills, improve their problem solving skills, and improve their emotional regulation and self-control skills, because we know most of the individuals, especially children and adolescents, they have difficulties in controlling they have very limited self-controlling skills. So it's very important to enhance their self-control skills and some cognitive restructuring and reduction of impulsiveness, self-concept, self-management, and promoting healthy social relationships rather than having artificial and superficial fake relationships through internet. And also promotion of awareness of subjective relationships, that personal relevance with technologies. And what are the main treatment objectives? The main objective, again, as I mentioned, to empower the person and empower the proper support system. So what are the main areas we should target in managing? To improve the symptoms, so physical symptoms and psychological symptoms. I think I mentioned the physical symptoms which can present due to problematic internet use or internet addiction, and the psychological symptoms which can come due to the problem. So we need to address these symptoms and then to improve the functional level, their physical activities, and to improve their activities of daily living, improve their academic performance, and also help them to maintain intimate and good peer relationships, and also help them to involve in community activities. Third component is to improve their well-being, that is spirituality, life satisfaction, how they see their quality of life, and also promotion of recovery. So these are the areas that we need to focus when somebody is having problematic internet use and internet addiction. So when we talk about addiction behaviors, there are two psychotherapeutic interventions done under, like the therapeutic interventions done under two contexts. One is the total abstinence, where the individual stays completely away from the sedative substance, or control use. But I think, as I mentioned in my first slide, we can't keep our children away from devices. So total abstinence will not be a practical approach. So then the main approach should be the moderate and controlled use. So there are many psychotherapeutic approaches like cognitive behavioral therapy and motivational enhancement therapy. In cognitive behavioral therapy, they identify the maladaptive cognitions and they change their cognitive errors. And in motivational enhancement therapy, the therapist help the individual to improve their motivation through non-confrontational effort. So I'm not going to discuss about these things in detail. So these are the main psychotherapeutic approaches which can be used for an individual with internet addiction and problematic internet use. So these are the basic treatment strategies, the behavioral strategies which can be used, especially with children and adolescents, if they are having problematic internet use. So first thing is practice the opposite timing internet use. That is, disrupt the normal routine and readapt new time patterns of using an effort to break the online habit. For example, if the individual is spending the whole weekend on internet, we can help them to introduce some breaks where he can do something else, where he can go out, do some other activity, exercise or something like to help the individual to break that cycle. Second is using external stoppers, like things that the child needs to do need to go to other places as prompters. Stay away from the internet. For example, if the individual is sitting and playing a game or staying on internet, they can set an alarm for half an hour. So after half an hour with the alarm, he get the reminder, then he can walk away and do something and come back, so that he is getting breaks. Or then to set some activities for him to do in between after these breaks, during the breaks. And the third thing is setting goals, where we help the individual to set their own goals other than staying on the internet, which will help them to realize that they are taking the control of the internet, not that the internet is controlling them. So that is really important, because most of the children, adolescents, and individuals, what we see is they don't know how to control that behavior. They have perceived, or they have already started thinking that the internet is controlling them and they don't have any control over this behavior. So it's very important for them to realize that they should have a control to their internet using behavior. Other thing is to abstain from the high risk applications, very addictive applications. And other one is the using reminder cards, where we ask the individual to write down 5 major problems caused due to addiction of the internet, and also 5 major benefits from cutting down the internet. So whenever they feel like going to the internet, we advise them to go through this card, so that it reminds them the adverse consequences of using the internet, as well as the benefits of not using the internet, so that again they get the control and they get the reminders. Other thing is to develop a personal inventory, where we advise the individual to make their own personal inventory and write down all the things which they have missed due to excessive use of internet. So it's a kind of reflective thinking for them to realize that how this internet use has badly affected them. So it's a reflective thinking for them to think what are the things that they have lost due to this excessive internet use. Another thing is to enter a support group to improve their social support network, and family therapy and family support is also very important, where we need to educate the family, avoid critical comments, and to discuss openly and support the individual rather than being judgmental and trying to stop this behavior forcefully. It's very difficult to, when it comes to children and adolescents, especially adolescents, when it's very difficult to control their behaviors forcefully. The main approach should be to give them the insight, and then give them the control of their behavior. Then it will work better than we try to forcefully stop the behavior in them, because then they will not listen to us and they will not going to stop the behavior. And what is the place of pharmacological management? Very limited evidence, because whenever a child or an adolescent is having problematic features of problematic internet use, the parents always want a medication to stop this problem. But unfortunately, we don't have any particular medication to treat this problematic internet use or internet addiction. There are some medications that are limited. It's only some of the case reports, like SSRIs, which will reduce the urges and compulsions, especially associated, if it is associated with depression. And opioid receptor antagonists such as naltrexone, it's only one case report. And mood stabilizers like lithium carbonate, again, few case reports only. Antipsychotics, methylphenidate. If these individuals are having other comorbidities like attention deficit hyperactivity disorder, as I mentioned in my previous slides about the risk factors. So if the individual is having ADHD, OCD, anxiety, depression, yes, we can treat these conditions with medications, but not the internet addiction or problematic internet use. And so what is the parent role in supporting children and adolescents with related to problematic internet use or internet addiction? I think, as I mentioned earlier, the first thing is to focus on prevention. So what are the things as parents we can do? First thing, be available emotionally with your child. Spend time with your child. Most of the time, what we see is parents do not spend adequate time with their children. So they get bored. They do not have entertainment. Then they tend to find these artificial social interactions, artificial emotional connection through the people they get to know through this internet online. So it's very important for parents to be emotionally available as well as spend time with your child and be supportive. When you realize that your child is struggling with the internet, then don't get angry, don't be don't try to blame them. Try to be supportive and try to identify the problem and warm and understanding approach and not to be judgmental. Another thing is having adequate adult supervision, because most of the time what we see is parents give devices to children without thinking about the consequences, and they only start worrying once they see that the child has developed problematic internet use only. Until then, they do not pay any attention. So adequate adult supervision is very important to prevent an individual developing problematic internet. And also be a role model, because most of the time what we see is adults use mobile phones and tablets, laptops as their main entertainment. So most of the time what we see, parents, they don't talk to their children. They always use the phone. They are always online. They always go to the Facebook, Instagram. So it becomes the role model. So then if we are using the phone all the time, children do what we like. They always try to imitate what the parents do. So because of that, it's very important to be a role model and not to use devices as the main entertainment in the home environment, and spend time with the family and have family quality time, and introduce your child alternative pleasurable activities. Most of the time what I see in my clinic is whenever a child comes to the clinic, usually these small children, like they get anxious, they get nervous when they come to a crowded place. So they might start crying or they might start showing some behavioral outbursts. So parents, they don't try to calm down the child. They immediately open the handbag and get the mobile phone and give it to the child. So the children or adolescents, they are not born with the devices. We as adults, we are people who have introduced it to the child. Nowadays, it has become a fashion. It has especially the mothers, they don't tell bedtime stories to the children. They always use these YouTube bedtime stories. They never sing a lullaby song before putting a child to bed. They always use this YouTube nursery rhymes. So these parents have started using these devices as the main parenting skill. So they use devices as the main mode of parenting the child. So that has to be stopped. So I think talk about the prognosis, the limited and inconsistent data. So that is why I always say prevention is the most important thing, and also to intervene at the stage of problematic internet use rather than wait for the child to develop addiction. So it comes to the end of my presentation. So if you have any questions, I think we have 15 minutes for that.
Thank you very much, Dr. Harshani, for an interesting and comprehensive lecture on smartphone and tablet. Now lecture is open for the discussion. You can unmute your phone or device, can directly forward your questions to Dr. Hettiarachchi, or you can put your questions in chat box and then we can take it up. And Dr. Hettiarachchi is happy to take your questions. Over to you, audience.
Yeah, someone has asked a very good question. Actually, I forgot to mention that point. The question is there any guidelines on the amount of screen time exposure for children? Yes. So according to the WHO guidelines, what they recommend is they do not for children who are less than 2 years, the WHO do not recommend any screen time. So what WHO says is not to give not to give access to any device for children who are less than 2 years. Children who are between 2 to 5 years can have access to any screen for half an hour to 1 hour, but again under strict adult supervision. Children who are above age 5, WHO has not given any particular time for them, but what they advise is, again, the children and adolescents should use these devices for academic purposes and for mainly for academic purposes and for information seeking, but they can use it for if they are using it for any kind of entertainment purposes, then it should be maximum half an hour to 1 hour, again under adequate adult supervision. Is it clear? So children who less than 2 years, no access to devices. 2 to 5 years, half an hour to 1 hour. After 5 years, WHO has not given any particular time, but what they advise is to children to get access to devices only for education purposes and for seeking information. But if they are using it for other entertainment purposes, again, half an hour to 1 hour under adult supervision.
Okay. Any more questions? You can put in the chat box. Darshani, can I ask a question?
Yes.
Yeah. So you talk about the screening time, and when we consider the type of programs in the internet, what type of program are more addictable? For example, cartoons or games, or likewise, are there any evidence that this type of programs are more vulnerable for as far as addiction is concerned?
Yeah, as I mentioned in my presentation about the theories behind screen addiction, that the individuals with deficiencies in reward deficient like reward deficiency pathways, so that when individuals are having limited, like their reward pathways are not stimulated with normal day-to-day things, so addiction becomes more common with where the behavior is stimulating our reward pathway more frequently. So whatever the internet program, like especially games, and they always provide rewards. Like when you play a game, you get points, you get marks, so you get stars. Likewise, the any activity which gives you reward, then the individual, there is a high risk for that individual to get addicted to that program. So mainly, if they provide rewards, then it is a main risk factor for addiction.
Okay, thank you very much, Darshani.
Another thing is, like when it comes to these games, there are two types of games. One is that individuals play with other individuals, and some games they play alone. So again, when they are when these games having violence and aggression, children and adolescents, brain neural circuits get changed. So when they continue to play video games which have more aggression and violence. So due to this synaptic changes, neuroplastic changes which happens in the brain, they can become aggressive, violent adults once they become adults also. That is why we always advise children and adolescents to stay away from video games which promote violence and aggression.
Okay. Thank you, Darshani. Now questions are coming in the chat box.
Yeah,
You also
and one
see.
question is, will it cause autism? Autism, autism is a neurodevelopmental disorder. So genetic, environmental factors, the multiple genetic and environmental factors lead to development of autism. So use of screen will not cause autism, but once individuals start using excessive internet, it can lead to unmask the symptoms of autism. Is it clear? Yeah. And have you seen anyone in your practice, children, having any regression of their learning skills like speaking and socialization due to this smart device addiction problem? Oh my God, we are seeing hundreds of children who have regressed their learning skills, speaking. We see so many children, they spend 12 hours, 14, 15 hours in the room playing game. Their sleep-wake cycles have totally revised, like completely changed. They sleep daytime, they stay awake during the night time, they don't go to school. So many functional impairment. So that is the answer to the question. Yes, we see so many children with regression, cognitive impairment, impact on socialization, yes, and academic performance, significant deterioration in academic performance. Another question is there a special treatment program to recover teenagers from pornographic addiction? According to my knowledge, in our country, at the moment, we do not have a special treatment program to recover teenagers from pornographic addiction. Usually what we do is individual sessions with CBT and different psychotherapeutic approaches. But again, due to our massive workload, sometimes it's difficult to spend adequate time on these individuals. And yeah, that's all I think. Is there any other question?
Yeah. Anybody, if you want to ask anything, any questions regarding the topic?
One more question. How can we identify this child is addicted? I think I have mentioned the symptoms of addiction as well as the symptoms of problematic internet use. So like addiction, I mentioned the features. I don't think I need to repeat the features, but the most important thing is whatever, if there is any kind of functional impairment in any area, either physical, psychological, education, mental health, social relationships, whatever, any kind of functional impairment or any kind of deterioration in your child due to excessive use of internet, then that is problematic internet use, and that is the point that we should intervene, right? And one more question. I saw there was a research finding child who does video gaming had improved working memory and better cognitive skills. I mean, people can can fund multiple research, like so many different people can fund different research the way they want, right? I think I don't want to comment about it. How can we counsel the patients as a doctor? I think that is what I mean. I have been discussing during my presentation. First thing, as parents, we need to be aware about the adverse consequences. Second thing, we need to educate the children about the adverse consequences. Third thing is we need to empower, educate the parents about like how to maintain strict adult supervision. And if you see a child with problematic internet use, again, the first thing that you need to educate make the child aware that was consequences. That is very important. And then we can use the strategies which I mentioned earlier. Flashcards, give the control, maintaining the inventory, likewise for them to have a control and start using other alternative ways to change the behavior. And madam, when children are exposed to screen time, say for half an hour, is it recommendable to expose that half an hour continuously or divided time slots through the day with breaks? Half an hour, if you are giving your child half an hour to 1 hour period, maybe if you are giving the child 1 hour, then maybe you can break it to half an hour. The problem of breaking this half an hour is then the time will like increase. The child might take, like, just imagine if you are going to give the child half an hour, you are going to break it to 10 minutes. So this might further increase, or 15 minutes. Like, so it's better to give a one shot and then stop. Whether it is half an hour continuous or whether you're going to break it, I don't think it will change anything.
Are there anybody wants to put your questions to Dr. Hettiarachchi? So still you have a time. As there are no more questions in the chat box, there's another question, Darshani. What risk you see in children?
Children getting used to artificial intelligence. Children getting used to artificial intelligence. The thing is, what do you mean by the, I'm not very clear about your question, Medini.
Medini, if you want to ask, you can.
Yeah, if you can just clarify, like, what risk you see in children getting used to artificial intelligence, chat box. The thing is, when the children are, Medini, if you want to talk, or you're going to type. Or maybe I'll answer the way I understood then. So, yeah. So,
you go ahead, Darshani. You answer. Medini, in the meantime, you can
chat groups. Yeah. Now I got it. Yeah, chat groups you're referring. Yeah, the thing is, like, when they get engaged with these chat groups, we don't know who are the other people in these chat groups. So different people, different organizations, whoever want to manipulate these children, they can get locked as using different names. So we don't know who these people are, and we don't know what is their underlying motive. So it's kind of dangerous. That is one thing. And when it comes to, so it's these chat groups it's really, it's a disaster, becoming a disaster. Because, for example, if someone wants to get adolescents to get engaged in substance, they can use, like, adolescent name, and we just can pretend as an adolescent, can get enter to this adolescent group, and they can gradually manipulate and change their mind, these adolescents' brains. So we don't know who are they. So we can't guarantee the safety in these chat groups. So it's very, very important whenever your child is in any kind of chat group, you should know the problem is adolescents. They become very secretive about these chat groups when it comes to chat groups. But as parents, it's very important for you all to know what kind of people your child is chatting and what kind of things they are chatting. It's really important. And will you recommend police action punishment to recover the teenager from pornographic addiction? Well, it's a very broad question. Police action punishment to recover the teenagers from pornography addiction. The thing is, according to the Sri Lankan law, like any individual who like they engage, if someone does some kind of any kind of sexual encounter with a child who is less than 16, then it is considered as a statutory rape. So then this individual should be punished. However, the individuals who are less than 16, like if they are having, like if they have features of pornographic addiction, it is the risk is for them. As far as it doesn't do any harm to the society, I don't think that we can take any legal action. We only can take a legal action if this behavior has any kind of harm to the society. So if the individual is having addiction individually, and if it doesn't, obviously, definitely it affects the individual. So we need to intervene. But if it doesn't affect the society, then I don't think we can do anything through police. And what about banning all items of kids for limited time? Affect them psychologically, as it's about peer pressure too. The question again not that clear. What about banning all items for kids for limited time? Again, it depends on the child's age and child's social interactions and what like, you know, again, it's a very broad question and vague question, because it depends on your child's age and for what kind of activities the child is using the internet. And so completely banning everything, yes, it might affect the child's psychological well-being. So again, the decision has to be taken according to the individual child's needs and child's development and child's requirements. And if you are going to completely ban everything and keep your child completely away from social interactions, that wouldn't be good for the child's psychological well-being.
I think with the interest of time, let me invite our co-secretary, Professor Chamara Dalugama, to propose vote of thanks. Over to you, Chamara.
Thank you very much, Dr. Bandusiri, and good evening to you all. As you know, BLISS is a very well received and a very popular program organized by the Welfare Committee of the Sri Lanka College of Internal Medicine. And today we had the second BLISS session under the new council for year 2023 with the theme to enrich clinical competence with compassionate care. And I'm sure you all agree that we had a very fruitful session today, and it was very well done on a timely and important topic. So first of all, I would like to thank the speaker of the day, Dr. Darshani Hettiarachchi, consultant child and adolescent psychiatrist at the Teaching Hospital, Karapitiya. Dr. Hettiarachchi, thank you very much for spending your precious time with us today and doing a splendid job. And next, I would like to thank the President of Sri Lanka College of Internal Medicine, Dr. Kumudini Jayasinghe, and all the members of the council for supporting this activity. And I must tell, the live wire in this BLISS program is none other than Dr. Bandusiri Rathnayake, Senior Consultant and a specialist in internal medicine. And he is the leader of our welfare committee, and he has been passionately leading this project. Once again, thank you, Dr. Bandusiri, and also I would like to thank all the members of the welfare committee. Then my thanks go to Sun Pharma for providing the virtual platform for this activity and sponsoring the whole event. Finally, I would like to thank all of you for your very active participation in this activity and hope to see you all in our next program in the month of March. Thank you very much and have a pleasant evening.
Thank you very much, Chamara. That is the end of this BLISS program. So hope to meet you all in another BLISS program in the next month. Thank you very much. Have a pleasant evening. Good night.